schools in Kentucky are navigating new rules for managing medications, ensuring a safer environment for students. It's a major shift in how schools handle both over-the-counter and prescription drugs, and it's happening across Kentucky. In Estill County, Kentucky, Superintendent Charlie Brock is preparing his district for the upcoming school year, which starts on September 3rd. One of the biggest changes this year is a new set of guidelines for medication administration, which came into effect on July 1, 2025. These guidelines, issued by the Kentucky Board of Nursing and the Kentucky Department of Education, aim to standardize and improve the safety of medication management in schools. Anytime the laws change, whether it's KRS or new guidelines from KSBA, we have to adapt, Brock explained. We're committed to following the law and ensuring the safest possible environment for our students and community. One of the key changes is that over-the-counter OTC medications now require a written order from a licensed medical practitioner. This new requirement is part of a statewide effort to ensure consistency and enhance student safety in school health services. We have our standard consent forms, but if a medication isn't listed on those forms, we'll need a note from the healthcare provider, Brock said. This ensures that both the provider and the parents are aware of the medications the child is taking. Brooklyn Moreland, RN, and the district health coordinator for Estill County Schools is actively working to ensure that all school nurses are fully informed about the new guidelines. She is visiting each school in the county to provide training and support. Here's a summary of the new guidelines as outlined by Moreland. All medications brought to school by a parent or guardian for administration by school staff, including prescription medications both daily and short-term, and all OTC medications, must come with a healthcare provider's instructions and signature on one of the following forms. 1. Consent Release Forms Medication. These forms, available online or at the school health unit, cover both prescription and OTC medications. You can access the form here. https://document/D1ANLBXED/1A-UNBXL. Edit USP sharing. 2. Individual health plan. For students with chronic health conditions, an IHP must be completed for common issues like headaches or stomach aches. 3. Healthcare provider's written statement. This should be on the provider's letterhead and can be part of a broader health plan, such as a DMMP 504 or IEP. Parents or guardians can still bring and administer OTC medications to their child during the school day. But if they want the medication to be kept at school, a healthcare provider's signature on one of the above forms is required. The forms also allow healthcare providers to approve self-carrying medications for certain conditions if deemed appropriate. We understand that this transition might be challenging, but it's all part of our commitment to creating a safer, more controlled environment for medication administration in our schools, Brock emphasized. But here's where it gets controversial. Some parents might find these new requirements burdensome, especially if they need to visit a healthcare provider for every OTC medication. However, the goal is clear: to minimize the risk of medication errors and ensure that every student receives the care they need. What do you think about these new guidelines? Are they necessary for student safety, or do they add unnecessary red tape? Share your thoughts in the comments below.